Take Paws has been made possible by support from the following Community Foundation of Broward funds. And by Broward County Animal Care and Adoption, where you can adopt a new best friend for life. Hello and welcome to Take Paws, a show that's all about caring for the health and happiness of our furry friends for life. I'm your host, Mike Moscatello, and this is Peanut. Peanut is one of the lucky shelter pets because this fine kitty has been adopted. Good for you, Peanut. So long as this furry feline is well taken care of, she should live a long and happy life. But since we normally outlive our pets, somewhere down the line, Peanut is going to start showing signs of aging. When your pet gets older, arthritis can set in, making it difficult and even painful to get up and get around. It's important to let your veterinarian know if your pet is having problems with mobility. There's plenty that can be done to help give your little pal a little more pep in his step.
As dogs get older, and cats as well, we tend to see some fairly predictable changes. One of the most dramatic that we notice is the graying of their muzzle and around their eyes. Paige here is 13, so she's been going gray since she was about 5 years old, and now she's started to go on the ears as well. We also tend to see, again, especially in dogs, some haziness in the eyes. They're not cataracts, that's a normal aging change as dogs get older. Affects their night vision a little bit, but beyond that, not too much. Many older dogs lose muscle mass. They tend to have a little less muscle as they get older and as they age, and that makes their mobility a little worse, on top of changes like arthritis, which affects up to 20% of dogs, adult dogs. We also tend to see a little bit of decrease in their coat quality, a little bit of decrease in mobility. Sometimes they'll have trouble that is not quite so visible. Paige here is losing her hearing as she gets older, so we have to make sure when we try to get her attention that we go to her and make sure that she can feel us or see us as well as hear us. We do see some breeds age a lot faster than others, so generally speaking, the larger the dog, the faster they age and the sooner they enter old age. Smaller dogs like Chihuahuas, Poodles, they tend to age much more slowly, and therefore they live a lot longer than bigger dogs too. So at 13, Paige is about the average and a fairly average sized dog. Some of the bigger breeds we only get 7, 8, 9 years. Some of the smaller breeds, it's not unusual to see Chihuahuas 17, 18, 19 years old, occasionally even out to 20. Besides the changes that we see on the outside of the pet, it is very common as they get older that they start to have trouble on the inside too. So common things we see, kidney disease in cats especially, a silent disease we don't usually find until we look on blood work or until it's fairly advanced. Paige has thyroid problems, and one of her litter mates had a heart murmur that developed as they got older. And these can all be common reasons that dogs start to slow down, that cats start to be finicky about their food or become intermittent vomiters. We often also will see changes in their bones and joints. Just like as we get older, we get achy joints, we get arthritis, so do dogs. We know that that affects up to 1 in 5 adult dogs. And what we're learning more and more as we study arthritis in cats is we've learned that they don't show it very much, but lots of cats have arthritis. Keeps them from jumping up onto the counters like they used to, keeps them from being as active as they were. Those things can affect their quality of life more than we know. Many times we don't know how much their thyroid disease, their kidney disease, their heart problems, their arthritis has been affecting them until after we treat them, and people come back and tell us, wow, it's like I have a new dog. I didn't know that there was a problem until we treated it. So it's really important to stay proactive in looking for problems, checking their blood work every year, getting a good physical exam so that we can make sure that these guys are healthy. It's really important. When pets start to get arthritis, one of the early things that we hear a lot is that they're slowing down. They don't want to get up like they used to. They don't want to move around like they used to. I often hear people say, oh, he's just getting older, she's just slowing down, and people attribute that to a normal aging change, and it's not. When we see pets who are reluctant to rise after they've been asleep, especially if they tend to warm out of that, meaning as they get more active, it goes away. Reluctance to go upstairs. In cats, many times you'll see that they just develop a new favorite place. So all of a sudden they're not jumping up on the back of the sofa. They're not jumping up on the counters like they used to. Those are all common things that we see. Shorter walks, less enthusiasm for those kinds of things. We see cats who get grouchy or don't like to be petted anymore because they're uncomfortable. And when we go to pet them, they're afraid we're going to hurt them. We also see a lot of older pets who don't show many signs at all until we see an injury. So acute injury can often be a sign that there's something more chronic going on as well, that they've hurt themselves because they have arthritis. Some dogs will lick or chew at their joints where they hurt, especially up at the front legs near the wrists. We'll often see that, big sores or saliva staining right over the wrist. It's a good indication to get some x-rays and see what's going on in there. When we talk about treating pets for arthritis, the hallmark of good treatment is what we call multimodal therapy, meaning we're going to do several different things together. So we work on weight loss to make sure that they stay at a nice healthy weight, because all the extra weight is extra work for their joints and bones. We make sure that we're getting them good anti-inflammatories, and for dogs that are candidates, we like to make sure we're using non-steroidal anti-inflammatory medications to not just relieve the pain, but also to slow down the progression of arthritis. We do have other pain relievers for dogs who are not candidates for non-steroidals, or for people who are uncomfortable with that, because sometimes people are uncomfortable with those medications. We do also have some really good alternative treatments. So a lot of pets taking joint supplements, glucosamine, chondroitin, those kinds of things. One of my favorite treatments is an injectable medication called Adequan. It's an injectable joint supplement, and I've had people come back raving about the results they get with that medication. And many dogs that are able to do well with that without any additional treatments, which is great. We do also use laser therapy. Laser is called cold laser as compared to the surgical lasers that people are familiar with. And when laser light interacts with tissue, what we see is a decrease in pain, an increase in circulation, and a decrease in inflammation. So it's a nice non-drug treatment for arthritis so that we're not seeing any side effects. So for either owners who are uncomfortable with oral medications, or for dogs who are not candidates for one reason or another. They have kidney disease, they have liver disease. Also very good laser therapy and Adequan for cats, because we don't have good long-term pain management options for cats. So we're very limited in what we can do for them, but we get great response with things like laser therapy and Adequan. If you're noticing changes in your older pet and you think that we may be dealing with arthritis or with other changes, I would definitely encourage you to go see your veterinarian. We tend to see a lot of dogs where people have presumed that the aging changes that they're seeing are normal, and many times they're not. They're things we can do something about. Thyroid problems, kidney issues, heart problems, arthritis, and if I can help you to give your dog or cat better quality life, and more years and better years to their life, especially in senior pets, I think that's a huge part of what we do as veterinarians, and we want to be there to help you with that. So if you see anything, go see a veterinarian so we can make sure that we can get you guys the best quality care.
If you'd like to help support Take Paws through sponsorship or by making a donation, call 754-321-1000 or go to BECON-TV.